This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning and welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning is Dr. Ginger Layne, breast imaging radiologist. You may have already noticed, watching some football over the weekend, the players wearing some pink cleats, pink towels, pink hands. October is Breast Cancer Awareness Month, and we'll be talking about detecting breast cancer and breast cancer screening. But let's welcome in Dr. Ginger Layne. First, Dr. Layne, good morning. Thanks for joining us.
Thanks for having me. I'm happy to be here.
Well, we'll get into the subject, but I'm sure they have warned you ahead of time. You must talk about yourself at least for a couple of minutes here on the program. So give us a little bit about your background. Where are you from? Where'd you go to school? And how did you end up working with Mon Health?
I grew up in a small town in southern West Virginia called Gilbert, which is in Mingo County.
Yeah.
I obtained my undergraduate degree in chemistry from Marshall University, and then I came to WVU for medical school, internship, and diagnostic radiology residency. And I moved to Pittsburgh for a year while I did my breast imaging fellowship at the West Penn Allegheny Health System in 2011, and I've been working as a breast imaging radiologist since.
So why did you choose the specialty?
My specialty is diagnostic radiology with a subspecialty in breast imaging. And when I was in middle school, my dad, who was a coal miner at the time, decided to go back to school to our local community college to become a radiologic technologist. So my exposure to radiology began when I was relatively young. And then when I fast forward to radiology residency, I immediately fell in love with breast imaging during my first rotation. I really liked that it was a mix of reading films and performing procedures, getting to talk to patients. And I often think about how my patients are moms, daughters, wives, sisters, community members who have goals and aspirations, and I have a unique opportunity to potentially help them have more years doing the things they love with important people in their lives, and I can't imagine doing anything else.
Our guest this morning is Dr. Ginger Layne, breast imaging radiologist. So I mentioned October is Breast Cancer Awareness Month, and we're going to be talking about detecting breast cancer. So can you share what are some early signs people or women should be looking out for when it comes to breast cancer?
Sure. Signs and symptoms of breast cancer can include a breast lump or thickening, new flattening or turning inward of the nipple, changes in the color or texture of the skin, change in the size, shape, or appearance of the breast, and peeling or crusting of the nipple. However, the most important thing to note is that early breast cancer usually has no symptoms at all, and the best way to find breast cancer at an early stage before there are symptoms is to get an annual screening mammogram beginning at age 40.
We'll get into that in just a little bit. Are there steps women can take to kind of keep an eye out for these symptoms, or just keep an eye out in between your annual screenings?
Of course. Patients could choose to do a monthly self-breast examination, and I recommend this be done in the shower at the same time each month, so that the patient doesn't forget. The shower makes it a little easier to do the examination. If the patient is still having menstrual periods, she should do it the week after that. It's easier to feel changes during that time.
Dr. Ginger Layne is joining us, breast imaging radiologist. So as a breast imaging radiologist, what kind of patients are you mostly dealing with?
Well, most of my patients are women who are 40 and older, because that's typically who's getting their screening mammograms. However, we also see men and women of all ages, because those patients can also develop breast cancer and other breast-related issues.
So what kind of imaging are we talking about? When I say breast imaging radiologist, what kind of imaging are we talking about?
Mainly mammography, ultrasound, and MRI, and these can be done either in a screening or diagnostic setting. So a screening study is when a patient has no symptoms and they just come in every year to get a checkup, and diagnostic is when they actually have a problem or when we see something on a mammogram and we need to take a little further look. And of course, we also do procedures as well, such as image-guided breast biopsies, aspirations, and localizations.
Can you just walk us through as best you can what if a woman comes in for a mammography? What is that appointment like? Can you just walk us through it?
Sure. The technologist they check in at the front desk, and then the technologist would come and get them and have them put on a gown it's kind of like an upper gown, and they'll take them into the room. They usually do 2 images of each breast. It's pretty quick. It's like 10 or 15 minutes for the total exam, and our technologists are really great. They know that the patient is nervous, and they will talk them through it and make them feel more comfortable with the study.
Dr. Ginger Layne is our guest this morning, breast imaging radiologist at Mon Health. Got to take a quick break. We'll continue our conversation in just a moment. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Dr. Ginger Layne, breast imaging radiologist. Of course, October is Breast Cancer Awareness Month. Dr. Layne, before the break, we were talking about mammographies, the screenings that are available. I like to ask this question of all the doctors when we're talking about these preventative screenings. Very simple. Are they that bad?
No, they're not. The mammograms are not bad at all. I know getting a mammogram can be very scary, especially if it is a patient's first time. And we know this at Mon Health, and we understand how you're feeling, and we'll treat you with patience and kindness. And we typically get those results back out to you within 24 hours, because I know one of the most anxiety-provoking experiences of getting a mammogram is waiting for the result.
Yeah, and just I know from, experience going to the doctor's office, you can oftentimes build it up into a lot more than what it actually ends up being. So just knowing that it's not that bad, I think it sounds like a very simple question, but it's a big deal.
Yeah.
How you said you can turn the results around in 24 hours? Is that typical for all mammograms?
Yes. So when patients come for a screening study, when they're not having any problems at all, we try to get all of those out within 24 hours. If a patient has to return for additional imaging, like we saw something on their mammogram, first I would like for patients to understand that this does sometimes happen, and it does not mean that you have breast cancer. It just means that we need to take a little better look at something on your mammogram. And when patients return for that diagnostic workup, we get the results and plan to them before they leave that day.
Do you offer 3D mammograms?
Yes, of course. We offer 3D. 3D is very beneficial, especially for denser breast tissue. It helps, it kind of like unmasks the dense tissue. And patients can visit monhealth.com/mammogram to schedule their 3D mammogram at their leisure whenever they would like to.
Can you just go through the steps? Patient comes in, gets her mammogram. You said you see something there. You schedule a follow-up, and let's say breast cancer is detected. What are the next steps in the process?
So if breast cancer is detected, of course those results will go to the patient's referring provider to let them know what's going on so that they can be closely involved with the patient. And then we would refer the patient to a medical oncologist as well as a surgeon to discuss with them the further steps, which can be, depending on the type and how large it is, things like that can be a lot of different ways to treat that.
Is it any different whether a patient is coming in for an annual screening or if a patient is coming in, has been referred because maybe she found a lump, maybe something turned up in an appointment with the primary care physician? Is the process basically the same?
Yeah, it's pretty much the same. The only difference is if somebody doesn't have a problem, we usually detect that on their screening study, and then they would come back in for a diagnostic. Whereas if they have a problem, they start off with a diagnostic study, so they will know what we're doing and what our plan is before they leave that day.
How do patients make appointments? Do they need to be referred with a primary care physician? Can they just call you up out of the blue?
They do need to have a physician order to get a mammogram, and then they can get online at monhealth.com/mammogram to actually schedule once they have an order from their physician.
And can that be an OBGYN gynecologist as well?
Yes,
Okay.
any other physician who takes care of their breast health.
We're talking to Dr. Ginger Layne, breast imaging radiologist. October is Breast Cancer Awareness Month. How important, and I'm sure you've had this conversation many, many times, but how important is the annual screening, the checkups, the self-examinations to catch breast cancer in the early stages?
It's extremely important. Mammography is the gold standard of breast imaging, and it's the only screening study that has been shown to reduce breast cancer mortality. Just by getting annual screening mammograms beginning at age 40, the breast cancer mortality is decreased by about 42%. So it's very effective.
How do you work with the cancer team there at Mon Health? Because one thing I've learned from hosting this show for several years now, Dr. Layne, is that it's not just one department or one doctor. You get a whole team when it comes to your care. So how do you fit into that team of care professionals there at Mon Health?
So, of course, the radiologists work closely with the patient's referring provider to let them know what we're doing and what our next recommended step is so that they stay in the loop. We work with the pathologist once we do a biopsy to figure out exactly what's going on. And then once we have a diagnosis, we do work closely with surgeons, medical oncologists, and radiation oncologists to help to create an optimal treatment plan for that patient.
Talking to Dr. Ginger Layne this morning, breast imaging radiologist. I've heard you mention a couple times age 40 kind of being the line there where you need to start getting those annual mammograms, annual screenings. Are there any circumstances in which a woman should start before the age of 40?
Of course, if the patient has a first-degree relative, such as her mother, who had breast cancer before the age of 40, they typically start annual screening 10 years before the age at which their mother was diagnosed. Also, patients who are high risk, like having the BRCA gene or other genes that increase your risk, we start mammograms and or MRIs between the ages of 25 and 30 for those patients.
This may sound like a silly question, but I'll ask it anyway. Unlike other cancers, say lung cancer, where obviously you don't want to start smoking to prevent it, is there really anything you can do to prevent breast cancer, or is it just a matter of remaining vigilant and doing the screenings?
Well, first of all, I want patients to know if you get breast cancer, it is not your fault. It's just, it just happened. But there are some things that you can do to lower your risk, and it's basically all of those boring things that we know are good for us, like exercising, eating a healthy diet with lots of fruits and vegetables, things like that. They help decrease risk of a lot of different things, including breast cancer.
Dr. Layne, that comes up at almost every show. Eat. Have a good diet, exercise, and they always throw in don't smoke or quit smoking if you are. It seems to be pretty good advice for just about anything we're talking about on this program each week.
Exactly.
Dr. Ginger Layne is our guest this morning, breast imaging radiologist. We'll continue the conversation. Got to squeeze in one more break. We're back in a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning is Dr. Ginger Layne, breast imaging radiologist. October is Breast Cancer Awareness Month, and Dr. Layne, what would you say, or what do you say to women who are hesitant about getting that annual mammogram?
Well, we know that it can be very scary, and we work hard here at Mon Health to make it a lot better experience for you. Our technologists are so patient and kind and talk with the patients and kind of take their mind off the study. So it's honestly done before they even realize it. And like we talked about before, I know probably the most nerve-wracking part of getting a mammogram, at least for me, is waiting on the results. So we do try to get those results out within 24 hours so that the patient doesn't have to worry.
How common is breast cancer in women?
It occurs in 1 in 8 patients by the age of 70.
Wow. So that in itself highlights the importance of the screenings and the self-screenings just to keep an eye. 1 in 8 is that's a pretty good chance, actually.
Yeah, 1 in 8 women. It's pretty. I mean, it's very high. It's the highest incidence of cancer other than skin cancer in women.
Wow. But the good news, if detected early, this is a very survivable form of cancer.
Exactly, and that's where getting your annual mammogram really shines, because it allows us to catch cancers when they're very small and very easy to treat.
Talking to Dr. Ginger Layne, breast imaging radiologist, this morning with Mon Health. October is Breast Cancer Awareness Month. Do you have information available for patients who might be nervous, or do you talk to them before the screenings and the test to kind of ease their nerves? How do you handle those situations?
Well, I don't usually see the patients when they're coming in for their screening study. It's the technologists, many of whom have been doing this for years, and the newer ones have learned very well from the ones who've been doing it for years. So they know what the patient is experiencing and how to talk them through it. When the patient comes in for a diagnostic study is when I usually step in and discuss with the patient what is going on and what the next steps are.
We talk a lot about mammograms, and you've referred to them as the gold standard. Are there other imaging options to detect or diagnose the type of cancer?
There are, so nothing replaces mammography. Anytime a patient decides to get additional screening studies for the breast, it's not replacing mammography, it's just an addition. And patients can choose to get screening ultrasound and screening MRI. Unfortunately, some of these things aren't covered by insurance, so it's a thing, we have to work through with the patient if they choose to do those things, unless they're high risk. But mammography, like I said, is the gold standard, and nothing replaces that.
I always take for granted, and I forget to ask this question, where are you located? Where do you practice physically, actually, here in town?
I'm at Mon General.
Okay. Sometimes I forget to ask, and there's another clinic, or maybe it's in Preston County, but so you are here over on the Mon Health campus, where everybody knows where Mon General is, obviously.
Yes, I'm physically here, but I also read mammograms for other places in the Mon Health system as well. So
folks who are in Kingwood, Preston County, maybe down in Marion County, is it necessary to come to Morgantown, or do you have screenings available in other parts of the region?
We have screenings available in other places as well throughout the Mon Health campuses. Oftentimes, if they do need a biopsy, they will come here, but the screening studies can be done at several locations.
But whether you're at one of the other locations or here in Morgantown, you still have the full strength of the Mon Health team at your disposal, I guess is one way to look at it.
Exactly.
All right. What do you want women especially to take away from our conversation today?
I want them to get their mammogram every year beginning at age 40 and know that we're here to make them feel better. It's not going to be a bad study. I know that especially first time, you might be really anxious, but it's going to be fine. It's not nearly as bad as you think it is in your head. Things that we haven't done yet, they always seem way worse. But once you get here, you'll realize it's just not a big deal.
And a lot of that, I will go out on a limb and say, is because of the people who you get to, get to work with, who you get to deal with, the technicians, people like yourself, Dr. Layne. That's really the difference when it comes, I think, to these screenings, any type of screening, any type of visit where you're apprehensive, you don't know. It's the people that really make the difference.
I agree, and the technologists here are so kind and will walk the patient through the process and make them feel very comfortable.
Our guest this morning is Dr. Ginger Layne, breast imaging radiologist. You can, of course, always get more information by going to monhealth.com/cancer. You can visit monhealth.com/mammogram to schedule a mammogram today. Dr. Layne, appreciate you stopping by. Good talking to you. Thanks for the time.
Thank you.